As the COVID-19 outbreak spreads across Europe, we're learning more about the toll the virus can take on those infected and the varying degree of symptoms. A group that's particularly vulnerable is frontline health workers. One such is Jonathan Peterschmidt. He's a doctor from eastern France infected by the virus and currently in quarantine. He told us how he and his family are coping.
Really, I feel very good. I'm maybe a little tired because I don't sleep a lot because I have 4 kids, but they will exhaust me more than the virus, I think.
So are you still spending time with your children?
Oh, yes. Right now we are in quarantine for 14 days. And in my family, we are 6, and 3 of us are detected positive. But more than that, in my wide family, we are now 16 people positive. So we are all in quarantine, yes.
So you're allowed to spend time together. Talk us through what a normal day is looking like. How are you getting food? Are you feeling worried? You seem to look fairly okay, I have to say.
Of course, yes. I can say we can live with the coronavirus, but not being so sick. Most of the time it's like that. 80% of the people getting the virus won't get very sick. For the kids at home, we are trying to entertain them, to try to discuss with them of the situation, but it's only been like 3-4 days now. So they are not yet so bored, but I think it's going to come. For the food and stuff, we have very good friends and family, and I have very nice patients that take care of me now, and they are giving us food and putting in front of our door so we can get food without going out. Yes.
It sounds like you've got a very good network of support around you. Just take us back to before 4 days ago.
Yes.
When did you start to think, maybe I've got this? Was it a symptom that attracted it to you? Was it that you'd been nearby someone else that you knew had a confirmed case? What happened?
No. In fact, as a doctor, last week, I felt like I got what we would call the flu syndromes. I was tired, I had headaches, I had rhinitis, but I was not so bad. But this weekend, I heard that some cases were found in the area where I live. So as a doctor, I didn't want to see my patient not knowing what I was carrying. So I tried to get tested. I was tested positive. So I didn't see my patients, and the main idea is that the focus is now on the church where I go often, because it's there that the people share the virus. We were a lot of people, like maybe between 1,000 or 2,500 people in these meetings, and I think a lot of people got sick there. And they carried the virus across some countries here because we are at the border and people came from a lot of places here.
That's a particularly large congregation to have 2,000 people meeting for a service, I guess, at church. Do you think maybe that churches is another area of society that should be looking at what kind of public meetings they're holding to give people advice to say, you know, this is what measures we're taking as well?
Of course, I think now in France we are changing the phase of the disinfection, because before this meeting the cases were not that many, but now I think the big meetings like sports meeting and stuff won't be able to take place. And for our congregation, at the moment that we have those meetings, we weren't aware that the virus was nearby, so we had the meetings without knowing it, and from now we stopped. Of course, every meetings here in the area. Schools are closed here too in my village, and the people are staying home when they know they went to this meeting and when they know they have symptoms. So that's the main idea. Stay home if you know you've been probably in contact and that you're sick.